This is the start of a video series talking about a partial knee replacement that I am going to go through. I'm going to give you a little background first. I'm 50 years old, former athlete and firefighter. I've been dealing with knee pain since college in the late 90s when I had a torn meniscus in my right knee that I did not have surgically repaired. Then in 2012, while working in the fire department, I ended up slipping and having another meniscal tear, again in the right knee. I went in for surgery then, arthroscopic, to clean it out, and also to have a plica, a bone spur, taken off. At that time, they saw some cartilage damage, but again, not severe enough that I needed to do anything at that point. It is now 2025. I've been having off again, on again, right knee pain that I've been treating with pain management, with shots, approximately every 6 months for the past 4 years. I've gotten to a point now that these shots do not work anymore to relieve pain. I went in for an initial consultation with an orthopedic the other day, and after looking at my x-ray, we determined that partial knee replacement of the right knee looks like that's the direction we're gonna go. With me, why I chose the partial instead of the full. Again, I'm young and I'm still relatively active. After doing some research and consulting with the doctor, we decided if I wanted to continue that active lifestyle that the partial was probably gonna be a better fit for me. As most of my damage is on the medial compartment, on the inside of my knee, and that's where I have all of the pain. It wasn't worth doing a full knee replacement at the age of 50, specifically because they wanted to keep as much intact of the good portion of the knee as possible. And with my age, the chance of me needing a full knee replacement was possible later, but if I got it done now, the chance of me possibly needing another full knee replacement as I age 20, 25 years from now, the chances increased. So right now, I'm at the point where I have the surgery set up in about 3 weeks from right now. We'll talk a little bit now why some of the other reasons that partial was a little bit better for me than the full. Again, limited damage to one specific area of the knee. With this partial knee replacement, I'm going to have probably better range of motion and a higher likelihood to continue my activity level compared to the full. The other thing with the full knee replacement compared to the partial is I get to keep my ACL, which is going to help probably in the stabilization of my knee. And again, continue to live the life I want to. The other thing with that is I wanted a little bit quicker recovery. The partial recovery time seems to be a few months faster. With the full, they're talking about not being fully recovered almost a year. As well, the partial, it's such a less invasive surgery. I should be back to full capacity, they said, in about 4 months. At that point, I should be able to run, start lifting weights under load, and just kind of being normal. Again, this is the first part of just a short documentation of what I'm going to go through over the next few months. concerning a partial knee replacement. The next video, we're probably going to talk about some of the pre-op stuff that I wasn't really aware that I was going to have to go through. That I'm really jamming into a short time period to get done before I get this partial knee replacement.